Hi, welcome to the Central Line Dressing Change Skills Ambassador video. Here I'm going to be showing you how to change our CHG impregnated tegaderms. First, we do have our policies and procedures. We have work instructions on SharePoint that walk you through this process, and we do recommend printing those off and having a second person there, making sure that you don't miss any steps. This is a very high risk procedure because of the risk for eclampsia. So we want to make sure that we're being extra careful and that we don't miss anything that might cause an infection. We do start with cleaning our workspace, so of course hand hygiene before you put on gloves. You're going to need some clean gloves so that you can wipe down your workspace. The other supplies that you'll need, we'll go over those real quick while that dries. Of course, you need to allow this to air dry before you put any supplies down on the table. You will need the sterile saline wipe in order to get the CHG impregnated tegaderm off. If you don't have these available, you can use gauze and a saline flush. That just tends to be a little bit messier. These are the preferred method. You'll need your Central Line Dressing Change kit that has most of your supplies in it. However, your sterile gloves and your new CHG impregnated tegaderm have not been included in the kit so that people could get the sizes that worked for them and their patient. So please make sure to grab those before you get started as well. All right, of course, when you're changing gloves, we're going to do our hand hygiene. We're going to put on clean gloves. Not yet, just kidding. First, you want to open your kit. I always feel like I should have gloves on to do that, but we actually included alcohol sanitizer so that you can do your hand hygiene beforehand, as well as 2 masks and your bouffant. Your hair should always be pulled back, or you need to have your hat on. Anybody within 3 feet of the patient needs to be wearing a mask. So if you have a parent, in the room who's helping to console the child while you're doing this, please make sure that they're wearing a mask as well. So that's what the extra mask is for, or for your friend that's reading off your work instructions. So once I've got those on, you're gonna clean your hands a lot while you're doing this Central Line Dressing Change, but that's important because we don't want infections. So you can tell I cleaned my hands because the gloves don't want to go on now. All right, so then I'm gonna come over here by my patient and remove this dressing. I find it easiest if I remove it one piece at a time. You just need to be very careful that you're not pulling out the central line. While they are typically sutured in, I have seen those sutures come out when patients are very sick, so you want to make sure that you're carefully removing that. This border will typically come up pretty well, but the CHG part of this tegaderm can be kind of sticky, and so that's where usually if you pull up the edges, and then that's where you'll need your sterile saline wipe that will help you get that CHG off. Uh-oh. Believe it or not, this actually works better on a live person than it does here on chest for chest. There we go. And then you can kind of fold that down. I would say this dressing's been on a little bit longer than the recommended 7 days. We do have to change pediatric dressings every 7 days.
Sorry.
Even if this happens, we do not ever use scissors around our patients. There we go. Got it. All right. So we do require dressings every 7 days in the pediatric world. Even if you have Algedex on, we still recommend changing after 7 days. Okay, so still trying to do that too early. This is why we like having somebody there to read out the work instructions, because this is a very like multi-step process, and it's very easy to get mixed up on where you're at. So first I want to get this opened up. I'm not going to touch anything yet because I'm not sterile yet. This is where I'm going to use my hand hygiene. Just flip that open and break it. There's 2 other things I'm going to do. First, I'm going to open up my CHG impregnated tegaderm. Using sterile technique, put it on my field, assuming it wants to come out of the packaging. Real life issues here, people. There we go. And then I'll open up my sterile gloves and put those on. Hopefully you have a little more table space than I do because your patient's actually in the bed, not on the table. You know when this happens. Y'all know this happens in real life. This is not anything new. At least I don't have a family member standing over my shoulder going, does this lady know what she's doing? All right. So we're gonna put that in the garbage. Now that I'm sterile, I can now touch my sterile field here. So inside, of course, I added my own CHG impregnated tegaderm. We've got this gigantic thing to hold your 4 items. So in here, I do have gauze in case I have a central line that is leaking and I need to put a gauze dressing on. Remember, the gauze dressings are only good for up to 48 hours or until soiled. I've got some tape, my nose stain barrier film, and my CHG. So I've got this on. Mom's been doing a great job keeping my patient calm. And then I'm gonna scrub. The CHG swabs are a 30-second scrub with a 30-second dry. Make sure you saturate that area really well. I've got my friend Amanda over there reading my work instructions and timing me to make sure I do a full 30 seconds. Make sure this gets really clean. You want it to be a nice vigorous scrub too, because that's really what helps make sure that you're getting all those nooks and crannies on the skin and making sure it gets really clean. Has it been 30 seconds, Amanda?
Yes.
All right, great. So now it's been 30 seconds. Amanda and I are gonna chat. I'm gonna talk to Mom for a little while we wait for that to dry. Half the battle is just keeping your patient still while you've got this thing open, because we definitely don't want it touching anything. While that 30 seconds goes by, I'm gonna get my barrier film. How are we doing on time there? Has it been 30 seconds, Amanda?
It has.
Fabulous. All right, so now that it's been 30 seconds, I can put on my no sting barrier film. Just around the borders, I don't want to get too close to where my CHG is going to be, because I don't want a barrier between my CHG and my patient. So my hands didn't get real wet with that. But one of the ways you can tell when that barrier film is dry is if your gloves are no longer sticky. Just wait for that to dry. As soon as that's dried, the great thing is you don't have anything else you have to add on at this point, because everything's inside of your CHG impregnated tegaderm. So once that's dry, no longer sticky, creating that good barrier between my patient and the tegaderm. Now I can put on my CHG impregnated tegaderm. Make sure I get a nice good seal. Hopefully not quite as good as the seal that I had on when on the last dressing. But I do want to make sure. So as I take this off, well, I can get it off. Oh, here we go. Chest doesn't give like a real patient does very well. There we go. Then I'm just going to rub this down, make sure that it's sticking, and that it's going to stay down. Now once I have that part of the dressing on, I'm going to take this part and put it underneath so that that part doesn't remain open, but we actually get a good seal down here at the bottom as well. And then date, time, and initials on this part of the dressing. And this will go right over the top, right there. There are these little tabs on the back that can come off, help you take it off of there, but that you should take off. You don't really want to leave those in place, as it could cause your dressing to come out prematurely. Thank you for joining us for the central line dressing change. Please remember, CHG impregnated tegaderms or Algadex dressings need to be changed every 7 days in the pediatric world, and gauze dressings are good for up to 48 hours. Of course, if a dressing is soiled, please make sure to change it immediately. And that'll be it for us. Thanks for joining us.